Our social innovation program that we will talk is culturally competent mental health care for Somali community. We know that culture affects the way people perceive health and mental illness. When the civil war started in Somalia in 1991, many Somalis fled their country and became refugees and immigrants in Western countries. Most of the Somalis in Western countries like Canada may have experienced trauma and violence. Therefore, Somali immigrants in Canada need mental health care which is trauma informed. However, many Somalis don't seek mental health services because Western conceptualization for mental illness may not accurately capture constructs of mental illness in Somali culture. For example, stress, depression, and anxiety are more likely to be displayed in Somali culture as somatic symptoms because there are no Somali words or terms for depression and anxiety. Several studies show that there is a miscommunication between mental health providers and Somali patients because most of the health providers are not aware health paradigms or health concepts within Somali culture. So we need to ask ourselves, what is the solution? The solution will be opening culturally sensitive counseling center to reduce barriers for mental health care among Somali community in Toronto. The idea is opening Somali tea shop as social enterprise. This Somali tea shop would be a place where Somali community can access culturally competent mental health care such as talk therapy. Several studies show that talk therapy is common within Somali community. Therefore, this tea shop would give Somali community in Toronto a space where they can come and share their stories about mental health issues. It also gives them an opportunity to increase mental health awareness. Also, in this tea shop, there will be a space for members of the Somali community who want to access culturally competent mental health care. This culturally competent mental health care will focus on traditional healing practices of Somali culture. Practitioners who will provide culturally sensitive counseling services to Somali members in this space will focus on alternative common treatments and perceptions of mental health and illness within Somali culture. This social innovation program has three main objectives. The first objective is providing culturally coherent mental health treatment. The second objective is increasing mental health awareness. And the third objective is reducing mental health stigma within the community. The funding for this social innovation program will come from the revenue which will be generated from selling tea, and also the revenue will be generated from the affordable fees for culturally competent mental health services for Somali community in this space. We hope that this social innovation will have social transformation impact, such as high level of mental health awareness and also high number of seeking help within the Somali community, and also offering or accessing culturally sensitive counseling services within the community. This social innovation program will have partnerships and will collaborate with religious leaders and institutions such as the mosque, settlement agencies in Toronto, and Somali community agencies in Toronto to provide culturally competent mental health care. Finally, we will do program evaluation, which is client outcome measurements. We will do surveys to understand the level of mental health awareness within the community. We will ask questions such as how many clients are reaching out to mental health services after conversations in the tea shop. If you are interested to get involved in the social innovation program, feel free to reach out and get involved. Thank you.